back. The chair next recognizes Ms. Lee from Pennsylvania.
Thank you, Mr. Chair. I think I might take just a slightly different route, and I would like to start by saying that I don't think that we should have healthcare that's tied to employment in the first place. The United States has the largest economy on earth, but we are one of the only wealthy countries where getting sick can bankrupt you, and your access to care depends on what kind of job you have, or whether you have one at all. Our current healthcare system tells people that their worth and their health depends on their specific employment status. In the wake of the Trump administration and DOJ's reckless mass firings across the federal government, it's now clearer than ever why tying something as essential as healthcare to a paycheck is harmful. We're hearing heartbreaking stories after heartbreaking story about the tens of thousands of people who are waking up one day suddenly unemployed and also suddenly without healthcare. A woman about to give birth to twins, a man in the middle of chemotherapy. We've heard from a senior desperately needing hip surgery. But let's also not forget, even those with employer-sponsored insurance can still struggle with healthcare access and affordability. Often I hear from working families who are underinsured, burdened by high out-of-pocket costs, skipping appointments, or drowning in debt for care that barely meets their needs. If they even have coverage, it often doesn't go far enough. And many are forced to choose between rent or groceries or paying thousands for their life-saving medication. Ms. Lilly, based on what you've seen in the blood cancer community, can you speak to the personal and financial effects on patients when they're denied coverage for life-saving care, not because of medical judgment, but because it's deemed too costly or not profitable?
Yeah, so I would say that this is unfortunately a call we often get to our information and referral center is, hi, I have insurance, but they're saying they're not going to cover this particular service. Unfortunately, the U.S. has led in biomedical research. We have amazing cell and gene therapies, and those therapies are probably the calls we get the most now, is folks being unable to access these services because they are so expensive. I'll also add that this is one of the reasons why Medicaid is so important. If we look at Deanne, who was diagnosed with blood cancer many years ago, she ended up on Medicaid because she could no longer work. Similar situation for Amanda, who lives in Michigan. Many of our patients end up not being able to work, not being able to maintain the coverage, and then end up accessing the Medicaid program because they are literally too sick to work.
Thank you. So unfortunately, being denied life-saving care based on cost isn't an exception. It's baked into the system. Investigations have uncovered troubling practices by health plans and their corporate service providers to conduct arbitrary, improper, and mass denials of claims. A ProPublica investigation found that Cigna built a system allowing doctors to instantly reject claims without opening the patient's file. Another investigation found how EVCor, a company contracted by insurers that cover over 100 million Americans, uses a secretive algorithm to drive up denial rates. One employee described executives directing staff to keep a closer eye on guidelines because we're not showing savings. Ms. Lilly, since private insurers often have a duty to maximize profit for shareholders, would you agree that a health system designed to maximize care and access for the public would help prevent these kinds of abusive denial practices and better protect patients?
I think it would, and I think having that transparency that has really been a theme of this hearing so far around what algorithms are being used, what are they based on, are they being double-checked, is there a human actually reading the results and saying, okay, no, this is all right, this makes sense. Does that human have the right expertise? Are they, if for my patients, an oncologist, or are they someone else?
And just to say, I think this is exactly why we need universal healthcare. We've spent decades trying to patch a broken system. The Affordable Care Act expanded access and curbed some of the worst abuses, but to be honest, it was a compromise. And since then, both Democratic and Republican administrations have doubled down on market-based models that hand over more power and profit to corporate actors, allowing private equity firms and hospital conglomerates to tighten their grips on the healthcare system. And where do these profits go? Straight into lobbying and political campaigns that block meaningful reform. That's exactly why we know this Republican Congress, this administration, and the billionaires and corporate lackeys won't support the policies working people actually need. That's why instead of seeking to bolster our health system, they're seeking to cut at least $800 million in funding for Medicaid, a life-saving program for our most vulnerable populations, including those who found themselves or find themselves recently unemployed. We don't need more tweaks. We need a system that treats healthcare as a human right, not a job perk, one that prioritizes savings, lives, not shareholder values. We deserve universal, guaranteed healthcare for all. I thank you all so much for your time today, and I yield back.
The